Hey, my name is Rob Weiss. I am a therapist. I'm an expert in the area of digital media and human relationships, human intimacy, and sex addiction. I've spent a good deal of time thinking and writing books for men and women who struggle with intimacy disorders of this type. And one of the more challenging populations that I've had to work with, and I relate to it because I too am one of these folks, is gay men. I don't think we can talk about gay men and addiction without talking about stimulants. One of the major challenges to the gay community, and I think in part as a result of all that repression and abuse and prejudice and all of that, is that drug addiction, as in most minority communities, is higher among gay men. So we see more drug addiction, we see more domestic violence, and we see more sexual acting out, and gambling and gaming and all of those problems. And we see them because the gay male community in general has experienced a lot of abuse, a lot of repression, all the things we talked about. And so it's not surprising that when a really powerful drug comes along that also works really well for sex, that gay men are going to get caught up in it. And so what we see is men picking up stimulants like crystal meth and using them for sex. Now, when I was younger, if I were to do speed in my 20s, we used to go dancing, or maybe we cleaned our houses. That's what we did under that particular drug. Today, with Viagra, Cialis, and those drugs that can give you an erection for days at a time, literally men are up for days and up for days. And you see gay men abusing stimulants in public sex environments where they will spend days at a time looking for sex and experiencing sex. So, couple of things about stimulants. Number one, the number two problem of substance abuse among all gay men is stimulants, the first being alcohol. Stimulant addiction is most likely to lead to HIV infection, physical and sexual abuse, institutionalization, mental health problems. Meth is a very, very, very powerful drug and very difficult to get off of. By the way, I do want to say that straight men or heterosexual men also abuse stimulants and go off and have their sexual experiences. But it's more often what I hear from a straight man is something like buying coke and seeing prostitutes and going off to a hotel, or buying a bunch of drugs and going to a hotel and looking at porn for a few days. But again, in both examples, men are getting their drugs and checking out in some sexualized environment for a couple of days with their stimulants and their arousal-based drugs, and they disappear. I had one client a long time ago who said this to me. He said, half the guys I meet online or on the apps, they're offering me drugs, and we usually end up spending a whole weekend together, watching porn or hanging out, inviting other men in. If I'm too high to get it up or to keep it up, I keep Viagra or Cialis or Levitra around so that I can keep going for days. When I'm out at the bars, he said, it seems like there's an endless supply of X or Special K or various drugs, party drugs that he can do. He wouldn't even begin to know, my client said, what to separate out, the drugs or the sex, because they're so closely aligned for him. And he said to me something like, acting out a whole problem all together, the drugs and the sex, seems so fused to him, he can't imagine doing one or the other. And the reality is for meth addicts and cocaine addicts, when they do have a lot of sex with a lot of drug use, they do pair the two. And I've had gay men in group therapy, for example, say to me, oh, you know, I had a really bad day yesterday and I thought about using and I wanted to get some drugs and I wanted to masturbate, and it's like all in one sentence. It's like they don't see the difference. They don't feel the difference between the sexual behavior and the drugs because they're so fused. Now that may or may not mean that the person is a sex addict. In other words, you might get them off the stimulants and they stop sexual acting out. But that doesn't mean you don't still have to talk to them about sex. So think about this, you know, if you are a stimulant addict and you've gotten sober, but you haven't looked at your sexual behavior, and you go pick up a prostitute or go to a bathhouse or go to a sexual environment, guess where the drugs are? And so it is very frequently the case that someone who is a meth addict or a coke addict will relapse over their sexual behavior because they haven't discussed it in treatment, they haven't discussed it in their recovery, and now they're going out and seeking sexual intensity, and what they end up is back on drugs. So these two issues really have to be looked at closely. If you're working with a drug addict who abuses stimulants, you really have to go through their sexual history and make a plan for what their sexual behavior will be like when they're sober from drug use. Otherwise, they're much more likely to relapse.